Right, let's go. My name's Aziz Rashid, and I was born in Bradford in 1966 at home, where my father had a tailor shop in the front of the house, but he became ill when I was quite young and then died, and so my mother brought up her 8 kids as a single mum. We lived in a council house, we were on free school meals, and she pushed education really hard for all of us, and we were all really successful academically and all got really good jobs. I managed to get into Oxford University, which was an amazing achievement for someone from the Pakistani community in Bradford, going to the schools that I'd been to. I then got a job at the BBC, which I loved. I started off in Global News Division, I worked for Network News for breakfast, and then moved up to Salford and was part of the team that moved 20% of BBC production from London to Salford. And you know, it's been a huge success and I'm really proud of that. As someone who's worked for the BBC for a long time, I saw the BBC as one of our great public service organisations that Britain had, and the best public service organisation we have is the National Health Service, and I wasn't sure if I had the right fit to work for the NHS. I didn't know if I had the right skills, and I saw a job advertised for an associate non-exec director, and I thought that was an opportunity for me to learn about the NHS, to see if I could be a helpful part of the organisation. And after 2 years, I realised that actually the skills I'd learned as a manager for 20 years at the BBC were some of the skills that the NHS needed too. So like everyone in Britain, I'm really proud of the NHS. It's going through a really difficult time, and actually it's a difficult choice to choose to work for the NHS. I know that's a difficult choice for our staff sometimes, and it's a huge issue after we've had so much pressure, 2 years of COVID. But you know, good people have got to want to work for the NHS because it's a great organisation and it's worth working for and fighting for. Having grown up in a working class community, in the Pakistani community, I really care about people's life opportunities, about equality of opportunity, about diversity, and in all my roles at work and here at the Northern Care Alliance, I am a champion for diversity and equality and equal opportunities for people. And outside of the Northern Care Alliance, I work for the Social Mobility Foundation, which is trying to get able pupils from working class backgrounds from some of the poorer schools in our area into the best universities in the country, and that involves me mentoring kids and me introducing them to the idea of that they can go to good universities just like anyone else if they're able kids. I also work for the Royal Exchange Theatre, which I have a great love of theatre and entertainment, and you know, I also am a diversity champion in that role too. I care passionately about the fact that women have also got equal opportunities, and in my work I had management teams that were as many men as women in those teams, and women were promoted to senior editor roles, to presenter roles, and to technical roles. At the moment, the whole NHS in the country is under pressure, but of course we have to focus on specific things that are really important to the public. First of all, you can't have a great NHS without great staff. Our staff have been through the 2 most difficult years in the history of the NHS, and that's taken a toll on them, and the well-being of our staff, their working conditions, are the most important thing to the board at the moment, because we know that nothing will happen without our staff being in the right state of mind, being given the right support, and having the right well-being wrapped around them in order for them to deliver a good service. After that, when it comes to the medical priorities, emergency care is under huge pressure. That's also partly because of COVID, but there's lots of other reasons. Adult social care is causing a backlog of people being able to leave hospital, and so you know, looking at fixing emergency care and waiting times in A&E is really, really important. Cancer waiting times is another huge priority. Again, we've got a backlog. We've been working to reduce that backlog successfully, but that work continues and it must be reduced further. I think it's really important for my focus to be on the well-being of staff, because no service can be delivered without the well-being of our staff, and that will always be in the forefront of my mind. However, given my background and where I grew up, equality and diversity are really important issues for me. We have to see every patient as an individual person, but treat them equally. And that means an equality of outcome for patients, whatever their ethnic diversity, whatever their socioeconomic background, whatever their sexuality, and whatever their gender. It's really important for all our patients that they have an equality of outcome when they step into one of our hospitals or one of our services.